Welcome. If you're here, I'm assuming you're either an expecting parent, a parent of a new little one, or a grandparent, or a caregiver, but somebody who wants to learn about child development and understand it better. And I'm excited you're here because I have a lot to share with you. And we have so many changes in the last 30 years, really 35 years. And that's how long I've been doing this. I've raised my own children and things are totally different from when I raised them. So it's rare that I could use video footage or even pictures of my children because we had bumper pads and it was a different world. We had blankets and stuffed animals in the crib and very different world in what we're doing. And hey, everything we're learning is good. We have decreased the rate of SIDS by 50%, but along with the Back to Sleep program that started around 1992, it didn't really start getting enforced with parents coming home from the hospital till 1996 or later. We've increased plagiocephaly, and that is a fancy word for a misshapen head. And there's different types of misshapen heads, and there's a flat head in the back, and there's one flat spot on the right or left, and all of it is a little complicated, I think, because I'm always thinking hard with my head with how this baby's head got misshapen and what I can do to help them. And you know, the CDC has changed the milestone ages in 2022, the beginning of 2022, I believe. And that really has got a lot of people confused. They even took crawling out, and I don't know a single therapist that would recommend for your child not to crawl. And these are all the things I want to talk about. And so I'm just introducing myself. I'm Jennifer. Like I said, I have 2 grown children and grandchildren, a second one on the way. I'm super excited to share the differences that I've experienced with working with children for my profession and the success I've had with that, but comparing it to the world we used to have raising children. And what this has created is a lot of mixed messages from people out in the world saying, well, you slept on your tummy and you were fine. And, you know, we have to learn from what's happened and the research and dig deeper. And I'm really hoping to get to a lot of these topics. I'd like to talk about red flags and when it's really something to be concerned about. And, you know, early intervention is so powerful because a baby is born with 150 billion neurons, and then they have like 2,500 connections per neuron. And by the time they're 3, those 2,500 connections can be 15,000 connections per neuron. But if they don't use their new connections, then they go away. So we really have power in early intervention, and wait and see is just not what we want to do. But at the same time, we don't want to be fear mongering as professionals to parents and making them worried. And like, that's not what I want to do. I just want to educate and calm people about what they're seeing and whether or not they should be worried or not. There are times we do need to address something and it could be worrisome. Definitely, I deal with delayed development, and that's the big qualifier to enter an early intervention program. That's the majority of my work. But I also deal with the diagnoses like spina bifida and cerebral palsy and Down syndrome and genetic syndromes that are not, other rare diseases, muscular dystrophy, just a whole host of diagnoses. And sometimes things are not picked up early on, and the sooner we address what we're seeing, the better. So, but the majority of what we're seeing today is delayed development due to the fact that we're raising our babies differently. So, welcome again. This is just an introduction. Right now, I do not have a lot here on YouTube, hardly anything. If you really want to see more content from me right now, you'd have to head over to Instagram. It's the same name, Magic Moments Therapy. I'm hoping to get a lot more content out on YouTube and actually do a nice little couple-hour course developing things that I just mentioned, you know, a little deeper knowledge about what mixed messages we're getting, like baby walkers. You know, they're banned in Canada. The American Academy of Pediatrics doesn't really recommend them. What the alternatives are. There's just a whole host of things to talk about, and I think it's great fun, and I love working with babies, and I do think there's messages that need to be cleared up because we are really seeing a lot in our field. Our field is just booming because babies are struggling a little bit. Here's another example, you know, along with misshapen heads, which it used to be 1 in 300 in 1992, and now it's 1 in 2 misshapen heads, you know, so every 50% of our babies. And this is legitimate studies and research that I'm getting my information from. But torticollis can really wreak havoc with development. It doesn't mean that your baby's not going to be okay, but it can make for difficulty crawling. It can make for difficulty sitting up and balancing, and it can just really cause problems. And so there are ways to address that. There's ways to stretch a baby. I very much believe in an approach called total motion release, which hopefully is pleasant for the baby and helps them move in an unrestricted way after you help release them. And all of this can be taught to our families. Again, welcome.